Hello again everybody, it's Roger Duckworth, physiotherapist in Wokingham. I wanted today to talk a little bit about low back pain and neck pain, its prevalence, what can physiotherapists do about it, and some of the different approaches that myself and my colleagues may take in helping people achieve a much deeper resolution of their problems. Back pain and neck pain is hugely prevalent. The figures vary, anything from 60% of the UK population are expected to suffer back pain at some point in their lives. Depending on the research, sometimes they say that everybody will expect to suffer one episode of low back pain in their lives. So it's the second most commonly presenting complaint to a GP after the common cold. It is a huge problem. If we put that together with neck pain and a similar prevalence, then this is a huge problem. Physiotherapy, osteopathy, surgery, chiropractic, other forms of complementary therapy, acupuncture. There are so many different approaches and ways. It's a minefield for people. As many of you know, I'm a holistic and integrative practitioner and have studied many different disciplines to complement my core medical training and Western training in physical therapy. Many people want to know, should I see an osteopath, a physiotherapist and a chiropractor? Now I have done a blog post on this on the website, and I'll probably put together another video to discuss how I see some of the similarities and differences between osteopathy and chiropractic and physio. To summarise for here though, I think really it's about who, not what, because there is such an overlap. There are physiotherapists out there who operate in one particular way, and are much more hands-off and much more exercise-based, much more machine and electrotherapy based. There are chiropractors who are much more gentle and into craniosacral type approaches and fascial type approaches, as there are with osteopaths. Really, at the end of the day, our core training is different, but how we go about treating people 2, 3, 4 decades into our profession, often there's very little difference based on our title, and it's more about where our journey as therapists has taken us. Mercifully, surgery is largely unwarranted, and the good news for everybody is that surgery really is not that warranted. MRIs are a huge request from a lot of people, and we live in a world where we think that the camera never lies, and we think that surely an MRI scan must be, with the greatest respect, more accurate than what our clinical minds and experience can tell us. Well, I can tell you that factually is not correct. In our profession, we would, in the medical world, we would refer to these as ancillary treatments. Okay, I beg your pardon, ancillary tests. And they are just that, they're ancillary. They are an adjunct to what we do with our clinical evaluation. There is a wealth of research now to show that there is a very poor correlation between what we find on X-ray and MRI and the nature of patients' symptoms and their necessity for surgery. We would think that it's a very direct relationship, and it isn't. There was a very large study performed way back in the mid-90s by Bowden, revealed some interesting statistics that nearly 50% of the people in the study, and it was a large study with thousands of people, so it was a good, reliable study and is well acknowledged in the industry. 50% of people that had never suffered back pain were found to have disc prolapses in the lower 2 vertebrae. That's half of the people that have never suffered pain have got disc prolapses. And so we have to be ever so careful when people come to us and say, well, okay, we've got an MRI and there's a disc bulge there. That must be the cause of my pain, and surely physiotherapy can't help and I must need surgery. Well, the answer is no. Actually, we can't say that at all. And this piece of research, plus many others that have followed that sort of original work, tell us that that's not true. And actually, speak to any good spinal surgeon and they'll tell you that if you operate on the MRI alone, you'll come a cropper, because you won't get the results. It has to be part of a collective evaluation, our history taking, our pattern recognition, that contact with the patient is critical, and we can really figure out the majority before we even get you into a physical examination just by the history. So I really feel strongly about that and wanted to put across, mainly for reassurance, that just because we may find something on an MRI scan doesn't mean, oh my goodness me, I've got to have surgery and it can't get better. So that's an important thing. The same is true for many other things, including the shoulder and the neck. There are many abnormal findings that we find in people with no problems at all, with no symptoms at all. So what can we do about back pain? Well, a great deal, and NICE guidelines, the National Institute for Clinical Excellence, do recognise that physical therapies of all of the forms I mentioned earlier is the mainstay and should be the mainstay of the immediate management of low back pain. And whilst the evidence varies as to one approach or the other approach, the summary of all of that evidence is that provided there is some form of advice, some form of exercise, some do's and don'ts in the how to manage that, and some form of manual therapy of some kind, then this is beneficial and will speed up recovery and is the mainstay of management of low back pain and neck pain, rather than anything more surgical, which is great news. It is probably 2/3 of the caseload that comes into our practice here is neck pain and back pain. So often people are surprised by that and think, gosh, I thought you'd just be doing sports injuries. No, not at all. Spinal pain is the bread and butter of our day-to-day clinical practice. Of course, each clinician will have their own approach. Even within this practice here, with 4 of us working in subtly different ways with our own backgrounds, we will all have our own approach. There is no right way. Most importantly, your relationship with the therapist is probably one of the biggest predictors of outcome. But what's different about my way of treating back pain? Where have I evolved, and what do I believe to be the most effective ways of managing back pain? Again, many of you know that as a holistic and integrative practitioner, a real key tenet for me is getting to the roots of people's problems and not just putting fires out. We are trained, and I'll admit it, hands up, we are trained to put fires out as practitioners at college. We're quite good at it and getting the pain to settle down and go away. But all too often patients come back with a problem, or they've seen people, different therapists, chiropractors, osteopaths, other physios, even ourselves, and then they come back and go, it's going again. And I'm always looking to why. So of course, manual therapy of varying forms, soft tissue manipulation, yes, we can perform the high velocity manipulations, but personally I've found over the years I've become more and more gentle, and I can speak for my colleagues that they feel the same way. So yes, we can do aggressive grade 5 manipulations, the cracky crunchy type manipulations, but it's very, very rare for us to feel the need to do that. Why? Well, because I believe that at the end of the day, the skeleton is held together by soft tissues, and we must address the soft tissues. If we took all the soft tissues away from the bones of the skeleton, it would all fall apart. So, a bone, a vertebrae that becomes stuck in a position, doesn't move correctly, well, why? Again, my favourite question, well, why? Well, it has to be a soft tissue problem. Now, well, why is that? Is that a biomechanical problem in the way that you're moving? Perhaps there's some leg issues, leg problems with the knee or the foot, which might affect propulsion. Maybe we need to treat elsewhere in the body in order to try to relieve the overstrain and compensations that might be taking place in the back. So there's biomechanics. Of course, there's posture and ergonomics. And we've all in the last couple of years been probably working from home more and sitting more. And immobility is really not the friend of the human body. It really isn't. And we're not moving. We're not even getting on the train, getting in the car, going to have a cup of coffee at the machine, going to talk to a colleague in the office. People have been sitting, and often for longer hours. Getting up and moving is absolutely critical. So because one takeaway from this video is please just get up and move more, and try to be creative with how you operate if you are working from home. is take little breaks, and even just take a call standing up if you can, or do a Zoom call standing up if you can. Move around. People are much less formal these days, thankfully, and so people probably won't mind if we're on a call and we're moving around. Who cares? Look after yourself. We may have muscle imbalances, muscle weaknesses, but more often than not, I find that it's a flexibility issue which is behind people's problems, and things are tight, or there are differences and tight areas in one place of the body. It's usually the straw that breaks the camel's back, if you pardon the pun, when people come in. So there's usually a build-up of things, and I'm very interested to understand the backstory, what was going on before, or even what was going on the very first time that you developed a back problem. If you had a significant injury or traumatic event, car accident or something, okay, fine, perhaps it's a recent event. That would require one set of treatment. If you've had this problem for many years recurrently, then that might require a different, deeper approach. Very interested to see, many years ago, why a lot of my patients had irritable bowel syndrome or digestive problems with back problems, and I thought, I'm seeing this all the time. Now I have an understanding of the connectedness through from the viscera, the internal organs, through to the outer skeleton. It was originally an osteopathic kind of approach, particularly pioneered by people like Jean-Pierre Barral, and I've studied his work. And through manipulation of the interfaces between the internal organs and the outer skeleton, sometimes this is what's holding. And conventional treatments very often only work on the outer part and just release the muscle. That may get us up and going, but if the deeper issue is still there, it surely will come back again. Moving on again, well, to trauma work. Of course, there are many other videos that I'm creating on trauma work and somato-emotional work, and so I don't want to labour the point in this video. And if you haven't seen them, we'll put some links to the somatic work below and the trauma work and dissociation work. Traumatic memories are held in the tissues of the body, and there's mounting evidence for this and understanding from this in a scientific way. Then sometimes we need to use a very particular approach to being able to release that. Now we can release that through craniosacral therapy and somato-emotional release that way, or through nervous system regulation work and body psychotherapy work. But it does require a very particular approach to do that, and that's something that's a particular clinical interest of mine. All the time we're looking to get to the roots of the problem. So I appreciate that I'm going around lots of different approaches, and you might be looking for a how-to. How do I fix my back problem? Well, and there's lots of videos out there, and they're not wrong. But of course your confusion is, well, they say do this, they say do this exercise is the best exercise, they say rest, they say you need surgery. And the thing is, it's as individual as you are. It is very personalised. And it has to come from a thorough assessment of you. Our assessments in this practice are an hour long, and we could spend a good half an hour before we've even physically started to examine you, just through taking a detailed history. And it is in this that the real roots to finding the answer to your back pain lie. And I just wanted finally to say that there is great hope for people with back pain. And if you've had back pain for many times over the years and you're looking for a fresh approach, then please give me a call, and I really would be very interested to see if I can delve a little deeper into perhaps the real origins of your problem and get you a more lasting relief. The good news, one final point, please, just to take away is, please don't feel the need to fly off to a surgeon necessarily. We have great relationships with surgeons, and we do recommend surgeons on a regular basis. But please, I just wanted you to not be frightened if you are suffering back pain, that it's anything sinister or nasty. Mercifully, tumours, cancers, of course, do exist, but they are very, very rare, and the number of people that require surgery is low. In fact, the figures generally are that around 85% plus of people with significant low back pain, even with radiating sciatic pain, 85% plus get better with conservative treatment. A small percentage of people require surgical intervention. And in my opinion, I think that the figures could even be more optimistic than that if we really take an holistic approach and look at the relationship of other issues that might be going on in the body. So I hope there's a little bit of an interesting, different video on back pain and neck pain. I'm talking about back pain and neck pain. The same principles really apply. Manual therapy, a good assessment of what's going on behind it, biomechanics, posture, stress, other health issues that might be relating internally to externally. I hope this is of interest to you. If you've got any comments, please pop them in the comments section below. Remember to like and subscribe, and if you get subscriptions, you'll be notified about any other subsequent videos that I make. Thank you for listening. See you again. Bye.